about 51% of our children in this country are on medication. They have some kind of chronic illness. I mean, people don't even think that asthma, being on asthma meds, steroids, inhalers counts. It's such the norm to have food allergies, asthma, eczema, OCD, ADD, ADHD, Asperger's disease. These things are so commonplace that parents don't even count it. I'll have parents tell me, oh yeah, my kid's always healthy, no remarkable medical history. And then when I ask specifically, they were on antibiotics yearly, like 10 rounds of antibiotics by age 8 for strep and ear infections, and used inhalers, been admitted twice for asthma. This is not how it should be. We did not evolve. We evolved with our environment. We did not evolve. There's nothing advantageous about having recurrent strep, about recurrent ear infections, about having asthma. There's nothing advantageous in terms of evolutionary progression to develop these diseases. These diseases are man-made. Now, there's always been people with these issues. Typically, especially with autoimmune disease, you'd get a virus, you'd get a bacterial infection, and you have the right genetics, and so every now and then you would see an autoimmune disease develop because antibodies cross-match or they cross-react with parts of the body. But it was very far and few between. This is an exploding epidemic. It's not just autism. It's all kinds of man-made diseases. The cancer rates are out of control. The autoimmune diseases are out of control. We're seeing young kids with autoimmune diseases that we didn't see in pediatric populations before. And if you talk to the vets will tell you, because animals have shorter lifespans, that when they started vaccinating, they started seeing more and more autoimmune disease and more cancers. In fact, all 27 veterinary med schools several years ago got together and decided together to recommend less vaccines than they were recommending. So instead of annual vaccines for cats and dogs and horses, they were reducing them. They cut down the number. That was done as a consortium of veterinary med schools. They acknowledge that there's problems. I mean, cats will get sarcomas at the site of certain vaccine injections. So I actually got onto this because of talking to veterinary scientists about 20 years ago. And this is what we're seeing. So we're seeing not just the autism. What we need to do is everyone needs to be outraged at this. It used to be you'd get every now and then 1 in a few 100,000 kids would have issues, maybe develop diabetes type 1 at around age 10 or 11 when they were going through puberty. And now we have an explosion of these children, and they're developing it earlier. They're developing it much earlier. And I remember about 10 years ago, or maybe 15 years ago, a pediatric endocrinologist telling the theory was it was a vaccine reaction. These autoimmune diseases were a vaccine reaction. So I think we need to look at all these diseases together as side effects, as man-made diseases, as the price we're paying for certain environmental toxins, ruining our environment, including our internal environment with heavy metals and tween-80, which is polysorbate, and live viral material being injected directly into us. I think we need to look at that. We need to look at it really seriously and say, what's the price we're paying? The problem is we don't know what the risk-benefit ratio is for vaccination. And the reason we don't know is that we don't have safety studies. We don't have safety studies. I don't care what anyone says at the NIH or at the HHS. We don't have proper safety studies. Every Cochrane study on a vaccination, and they all end with the same thing, that safety studies are needed, because placebo studies for vaccinations are done not with inert placebos, but with other vaccinations, sometimes unapproved experimental vaccines, as with Prevnar was, and sometimes just with the aluminum adjuvant, but they're done with non-inert substances that cause issues by their own right. So we also don't have long-term effects. So we'll look at the first 10 days, or they'll look at the first 30 days, or they'll look at maybe the first few months. But we don't have proper safety studies, and there might be surveillance, but we don't have access to it. So we don't really, and we couldn't have proper surveillance either, by the way, because most doctors don't even know to report a vaccine reaction because they don't recognize them. So we can't even say what the risk-benefit is, what the ratio is. Does the risk outweigh the benefit? Does the benefit outweigh risk for this specific vaccine or the. And without knowing that, we don't know how to really recommend vaccines and for whom, because we have no idea what the true risks are.